Okay, we have the next speaker, and this is somebody who I met earlier this year and is one of my new friends. Mr. William LaBar is the Vice President at CGI Federal. Will leads the Lafayette Delivery Center here, which is just across the street for CGI. They've done amazing things by adding more than 400 jobs in Lafayette over the last 3 years and growing a technology and innovation ecosystem here in Acadiana. And I have to say, I got a chance to tour the facility when I was here. And these are not simply call center jobs that are commoditized. I saw a group of really curious and very smart people, engineers with, you can see their desks, multiple monitors, hundreds of rows of data, but also, 3D printing models and other parts, machines that these engineers are putting together to solve real-life problems. One had to do with streetlight issues across the state. Having smart people like that, a place where people that graduate from a great university that we have here with STEM degrees, and putting them to work here in our community to solve problems in our community and our state is something really great. And I'm happy to have CGI here, and thank you for being a sponsor today. So you're up next.
All right, hi everyone, my name is Will LaBar. I'm with CGI. Thank you for the kind introduction. And if you had told me this morning when I woke up that I would have, that following a coroner would be a tough job, that was an amazing talk. I was worried about following Bruce, but now I'm intimidated. As Bruce was describing, we have a partnership here with UL and the state of Louisiana and the Lafayette Economic Development Authority to open up a delivery center here. We did that in 2014. We have over 150 members working in the healthcare industry right across the street, supporting customers like Cigna, for example, as well as supporting CMS, and we have a team up in DC who supports the Office of the National Coordinator with Bruce and his team. I'll tell you just a little bit about that later. But I have a confession to make a little bit. I'm not from the healthcare space, so I have major imposter syndrome going on right now. And so when I was thinking about how I would have any sort of relevancy to this particular audience, and specifically, I figured I would talk to the folks who are engaged in the hackathon. I don't deal with 42 CFR, as Dr. Calico was talking about earlier, or not doctor yet, sorry. As David was talking about earlier, I deal with 40 CFR, which is the code of regulations for environmental enforcement. And so when I was trying to figure out how to make my background relevant to your challenge, I wanted to tell this story, which occurred in April 17th of 2013 in the town of West Texas. And what happened was a fertilizer plant there exploded. And it caused a crater there that was 93 feet deep. It caused a minor earthquake in that area. This is right around Waco, and spread debris in a 2-mile radius. And within a quarter of a mile radius of this fertilizer plant was a nursing home and a middle school, and within a half a mile, a high school. Right? And what the story of this plant is interesting, and I'll eventually, trust me, this comes back around to the opioids a little bit, is that it was last inspected by OSHA in 1985, and they were fined for violations related to how they were storing anhydrous ammonia, right? And then TCEQ cited them for violations in 2006 at a state level for not having a permit for some of their storage tanks. In 2006 as well, EPA found that they weren't filing a risk management plan. A risk management plan, if you're not familiar with this, if you have a certain amount of toxic substances at your facility and an explosion happens, EPA calculates an off-site consequence analysis zone, or the area around your facility that could be destroyed as a result of an explosion. And sure enough, that nursing home and that school were inside the OCA, right? And so they weren't filing the RMPs. 2012, DOT fined them for violations regarding to how they were storing anhydrous ammonia as well. And then open records from, that's the city of West, the Texas police, the local authorities, they had a series of thefts occurring at this plant, and the suspicion is that those thefts were related to people trying to make methamphetamine from some of the substances that were stored there. And then, this was new to me when I researched this, but Department of Homeland Security requires to be notified if you have more than 1 ton of ammonium nitrate at your facility. And the West Fertilizer plant had 540,000 pounds of it. And they've never informed DHS. Right? No one knew any of this, and what's interesting to me about this, and this goes back to the hackathon, is in the environmental space, we have these silos of information, and we don't have this interoperability and the ability to share data across these different domains. And if that had happened, we would have potentially seen that this is a high-risk facility, right? And I think this story crosses over into your all's domain, where if we can establish that interoperability across the healthcare provider ecosystem, as well as other subjects, we might be able to find where there are high-risk patients or high-risk communities and get into prevention as well as appropriate methods of treatment. And so to me, this was the best parallel I could draw between my 40 CFR world and your 42. And we do some work with Bruce's team. I mentioned it earlier, and we have an example of something like this with some software called Connect, which is based on National Health Information Standards and allows health information exchanges to occur on top of EHR systems. And so we did a project with the PMP InterConnect, or the PMP Gateway, which allows you to access prescription data from all the states that you see here in the green. It's a little bit different than David's map. I wasn't, maybe my source wasn't as good, I'm not sure, or maybe some of these are projected. But these are all the states that are participating in this exchange of prescription data. And so the project we worked on was working with a company called Apris. They have a PMP Gateway to get this data out through that exchange and bring it into sort of your ecosystem inside a healthcare provider system, and be able to more easily see a patient's history related to prescription drugs. And this was done for Veterans Affairs as a prototype to sort of take a look at soldiers before they were going out into the field of battle to understand if there was any particular risk there associated with it. Ochsner implemented this on top of Epic. David was talking about how they've implemented a very similar solution on top of Cerner. And this is where you see, and to go back to my earlier analogy, maybe just one of those two silos that were existing starting to break down because of this interoperability and standards. But the problem is as I was researching this a little bit, and my data's dated, sorry, Bruce. This is from the New York Times. I just thought it just told in a really stark story, right? A picture tells 1,000 words. And this is overdoses deaths in the U.S. Starting in 1999. And this strikes every community across all different kinds of demographics. And in order to get to this problem, maybe as we're thinking through the hackathon and you're coding through this, maybe look outside of just some of the direct medical data that's out there and start to look at some other causes and other data that's available openly accessible to us. So in New Hampshire, maybe access to treatment programs, or in Appalachia, we have a really high rate of this because we have a lot of blue-collar jobs there with high occurrences of injuries. And so understanding the workforce demographics associated with some of the data that you'll be seeing through the portal that's been stood up. And maybe looking at some of the environmental and social stresses that are around individuals in these communities, and maybe bringing a creative solution to the table through the course of this challenge related to that. Specifically things like economic disparities, housing instability, education quality, right? And also things like access to quality health. These are all different domains that's similar to that West Texas explosion that happened. If we can merge this data across the board, maybe we find creative solutions to help attack this challenge. I put this specific line here for Cian, so you have to listen to me for 1 second. We were at dinner last night, Cian's with Lafayette General Foundation, and I was like, how do I speak to a group of people about environmental conditions and opioids? And he's like, well, only thing I could come up with is if maybe you start taking a look at the waste treatment that's coming out, because maybe there's a high concentration in people's urine. And sure enough, they're actually looking at doing that in Cary, North Carolina, right? So this is a part of the Bloomberg's Mayor Challenge, where they're trying to use geolocation and taking a look at the concentration of substances coming through the sewage treatment plant in order to figure out where they might have communities at risk. And that was just too perfect to pass up, Cian. So it's like another just great example. And you can see here what the mayor's talking about. And these are game-changing types of ideas when you can figure out ways to take data across these different domains and pull them together, right? And so I'll leave you with this quote. We're not students of some subject matter, but students of problems. And problems may cut right across the borders of any subject matter or discipline. And this is a philosopher, I think he's Austrian, And I didn't know about it until last night at 2 a.m. when I pulled that slide together. His name's Carl Popper. But if I can, maybe just sort of add to that, I think the solutions need to cut across all these disciplines. And I really look forward to seeing what the coders come up with in the hackathon. And if I didn't say earlier, we are a proud sponsor of this event. And thank you, Ramesh, for your partnership and the opportunity to speak to you all today. And good luck on the challenge. Thank you.